I'm Christy Salerno-Kent. I'm 38 years old. I've had MS for 12 years. I'm married to my high school sweetheart. We have a wonderful son, and I'm also a singer-songwriter. In my daily living, I started noticing that I was changing things that I normally had been doing. I would avoid situations that had crowds. I would avoid situations that had me, at a sporting event or something like that where I would have to be keeping up with other people. I avoided simple things like going to the grocery store. I realized MS was changing the person I was, and it became unacceptable to me.
One of the last visits to the neurologist, he did the test that he normally does for her, and she thought she was doing really well. She's like, why do I have to do this test? I think I'm fine. And of course he noticed it, and then of course once he was able to say, here's what we're noticing, I was able to kind of
point out some things.
Yeah, to point out, to validate like what he's actually saying. There is some truth in it. We accommodated her disease, and if it meant that I had to go do the shopping so she could stay home and not have to worry about it, then I would do that. If we did go out and about, she would always have to push the stroller. She couldn't just walk by herself.
It was my son's first birthday, and we were at the zoo, and I couldn't walk the zoo with my son, and that was really difficult for me because I wanted to do that. And so it was after that trip we got back home, and I decided I have to do this. I have to set an example for my son, and I need to be there for him and be active. And so that was really the defining moment that got me to start taking my Ampera. As a performer on stage, walking is really important. You're in the midst of a song and emotion takes you someplace and you want to connect with your audience. You want to walk across that stage, and prior to taking Ampera, I felt frozen a lot on stage, and so now I'm able to just go with my emotion and walk in the direction I want to go in the moment, and that's really nice. One of the most exciting discoveries for me to find out after taking Ampera was that we took Kingston to a big theme park, and I was able to go from ride to ride and activities, and I never had to slow down. I was keeping up with everyone, and so that was really exciting. I think anyone who's considering Ampera, I think it's really important that you talk to your doctor. You have to be really clear on your everyday activities and how things are changing. And I think really talk to the people around you, your loved ones, because they're probably going to notice things that maybe you didn't even think about, or you don't realize how much it impacts you, but they'll be able to help you with that. So I think that conversation with your doctor and your family and friends is really important. This is your life, and yes, it's your life with MS, but it doesn't mean that you can't live it to the fullest.
Ampera, dalfampridine, extended-release tablets is indicated as a treatment to improve walking in patients with multiple sclerosis, MS. This was demonstrated by an increase in walking speed. Important safety information. Do not take Ampera, dalfampridine if you have ever had a seizure, have certain types of kidney problems. Do not take Ampera together with other aminopyridine medications, including compounded 4-AP, sometimes called 4-aminopyridine fampridine. Ampera can cause seizures. Your chance of having a seizure is higher if you take too much Ampera or if you have kidney problems. Before taking Ampera, tell your doctor if you have kidney problems. Stop taking Ampera and call your doctor right away if you have a seizure while taking Ampera. Ampera may cause serious side effects, including kidney or bladder infections. The most common side effects of Ampera include urinary tract infection, trouble sleeping, insomnia, dizziness, headache, nausea, weakness, back pain, problems with balance, multiple sclerosis relapse, burning, tingling or itching of your skin, irritation in your nose and throat, constipation, indigestion, pain in your throat. Take Ampera exactly as your doctor tells you to take it. Do not change your dose of Ampera. Take 1 tablet of Ampera 2 times each day, about 12 hours apart. Do not take more than 2 tablets of Ampera in a 24-hour period. Take Ampura dalfampridine tablets whole. Do not break, crush, chew, or dissolve Ampura tablets before swallowing. Ampura is released slowly over time. If the tablet is broken, the medicine may be released too fast. This can raise your chance of having a seizure. If you miss a dose of Ampura, do not make up the missed dose. Do not take 2 doses at the same time. Take your next dose at your regular scheduled time. If you take too much Ampura, call your doctor or go to the nearest hospital emergency room right away. Tell your doctor if you are pregnant or plan to become pregnant. It is not known if Ampura will harm your unborn baby. Tell your doctor if you are breastfeeding or plan to breastfeed. It is not known if Ampura passes into your breast milk. You should not breastfeed while you are on Ampura. It is not known if Ampura is safe and effective in children less than 18 years of age. For more information, please see the complete medication guide. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.